Kulkarni Law Firm. Hey everyone, welcome to another episode of Darshan Talks. This is the episode where people with 5 o'clock shadows get together and talk about the law. It's going to be a really great conversation because I have with us a guest we've had on before, Micah Berman, and Micah is at OSU, and he's going to talk a little bit about OSU being Ohio State University. He is going to talk a little bit about his experiences. His book just came out, and I want to tell you, if you're interested in public health law, that's where you go. It's if you go to the bit.ly link, bit.ly/new public health law, you should be able to find the book. But before we get started, Micah, you want to introduce yourself?
Sure. I'm Micah Berman, an associate professor here at Ohio State, joint appointment in the College of Public Health and the College of Law. So I'm a lawyer by training, but spent a lot of my time working with scientists and researchers here at Ohio State, largely on tobacco-related research, but on other areas of public health law and health law as well.
So that actually brings the essential question, right? I mean, how is public health law really that different from straight up health law? I mean, isn't health law for the public anyways? Like, what's the difference?
So the general distinction when we use those terms is usually public health law is we're talking about population level health as opposed to individual health. And usually, though not always, the public is also referring to the government. So we're talking about public policy and decisions that affect large groups of people. I like the tagline for the Johns Hopkins School of Public Health. Their tagline, again, I get it not quite exactly right, but it's something like saving lives millions at a time. It's thinking when we talk about health law, you're usually talking about, individual care, where you're talking about patients who are already sick. So that's another distinction, whereas public health law has a heavy focus on prevention and trying to keep people from getting sick in the first place. So, healthcare traditionally, although, things are shifting, but the healthcare and health law have traditionally focused more on the treatment side. So people who already have a medical issue, they're in the medical system, and you're talking about the set of legal issues that relate to people dealing with health problems. There's also, I know you've got a bit of a background in bioethics. There's also a distinction between bioethics and public health ethics that tracks that similar line, whereas bioethics tends to deal with individual patients and have a heavy focus on patient autonomy. And public health ethics talks about how we make ethical decisions at a broader population-wide level, not dealing with individual patients per se, but again, dealing with sort of millions of patients at a time and how you think about the ethical issues that are relevant.
So do you find yourself talking to bioethicists and finding that you're coming out of different answers because of your focus of individuals versus groups of individuals?
Yes. It's often it's a question of framing, sort of, as I said. And so it's not a question of there being a right answer or a wrong answer, but it's a question of what level are you looking at it from? And there can be cases where, the decision that is the right and ethical thing to do at the individual level then leads to lots of problems if lots of people are making that same individual choice, which might be a perfectly rational, perfectly reasonable issue at the personal level, then translates into problems at the population-wide level. So having that broader perspective, I think, is really important. And I mean, we can get into talking about the pandemic, but lots of those issues came up where the people that there are far more people that are trained and knowledgeable about bioethics than there are about public health ethics. So a lot of the times the people that healthcare systems and even governments were talking to were trained as bioethicists, and they were thinking about sort of individual patients where, sort of by definition, when you're dealing with a pandemic, you have to think about, the issues and the trade-offs. I mean, public health ethics is a lot about trade-offs. So it's understanding that when you have decisions, those decisions might be beneficial for some people and harmful for other people, and those are difficult ethical choices to make at a population-wide level. Whereas the bioethics issue, you're usually talking about the patient who's just in front of you. That was sort of in very broad terms. We can dig down into it if you want to.
Oh, absolutely, and we will. And I mean, the obvious one that comes to mind that everyone talks about around public health versus individual choice is this idea of when we say individual choice, we're talking about autonomy, but is the idea of vaccination, where people decide whether I want to give the vaccine to myself or to my kids, while at a population health level, it doesn't make more sense to do that. Give me a breakdown on the structure. How do you begin contemplating a framework to look at public health decisions? And are bioethical decisions part of the same framework, or is it a different analysis, or how does that work?
I mean, the framework that we use and sort of built our book around, and I should say the book is a co-authored book. So I'm one of the 4 authors. So Scott Burris, who's at Temple, is one of the authors, and then Matthew Penn and Tara Ramanathan Holiday, who are both at the CDC, are the other 2 authors. So it was the 4 of us who put the book together. And the framework that we used, talking about transdisciplinary public health, I know it's a hard word even for me to say, comes from actually a broader group of people that came together and helped pull together this framework. So I won't give everyone the credits, but a broader group of people and organizations involved in public health law came together. As actually, I will credit the Robert Wood Johnson Foundation for doing some of the convening to bring the group together to think this through. And the idea here is the big picture framing is public health law requires all different types of expertise to get together at the table and work on these issues together. And the transdisciplinary idea is the idea that it's not just sort of passing the baton from one type of expert to another type of expert, but everyone involved in using law to improve public health needs to have some basic understanding of all of the relevant types of expertise, so that you can talk to each other and work with each other across those disciplinary boundaries. So it starts with sort of the evidence gathering, and on the public health side, that's largely epidemiology is sort of the basic science of public health, because that's thinking about health at the population level. And so that helps you understand what your public health problems are that you're trying to address, and potentially how to deal with them. So what I did as someone who is committed to this idea of transdisciplinary work and spends a lot of time working with scientists is that I did I don't have or didn't have training in public health, so I did a certificate program a few years ago at Johns Hopkins, an online program. It in no way makes me an expert in any sort of public health science, but it was enough that I feel comfortable knowing the terminology and being able to have intelligent discussions with epidemiologists and biostatisticians and so forth. So, a few courses in epidemiology and biostatistics and toxicology and so forth. So that's the idea is, you start with the evidence, and then you think about legal tools and legal frameworks to translate that into policy. And so that takes different types of legal expertise. It's not just one directional, but it goes back and forth. That the science that is being done also has to be informed by understanding what the legal possibilities might be down the road. So, oftentimes this is something that's come up a lot in my career, is that, if you have researchers who are doing the science, but they're not thinking about how it might ultimately get translated into law and policy, then they've answered really interesting scientific questions, but not necessarily in a way that is usable in terms of translating what that might mean in terms of putting it together into law. So they're not necessarily thinking about, who would have the authority to do this, what level of government, what might be the constitutional restrictions, all those sort of basic legal questions. So again, this is talking about the importance of crossing those barriers. And then I think, the ethics part has to come in there too, thinking about when you're translating things into policy, it's not just about, there's no, it's not a mathematical formula. It's not, this is going to save more lives than that, so that's the better thing to do. There are questions of ethics, there are questions of priorities, there are questions of equity that have to come into play, and there are no easy answers there either. So having a background, and we started again trying to model this, started a reading group here to look at some of the foundational papers on public health ethics, and actually my dean here at the College of Public Health, Amy Fairchild, has written a lot of those foundational papers on public health ethics, and then the third piece is then to think about how this actually gets turned into law, and so that brings in other types of expertise, the people who have that political expertise and the community building expertise, and can build the community support. And that's a big part of the public, again, in public health, is making sure that you are doing things with community consultation and talking to the communities that are affected by the policies that you're talking about, and thinking about how you build that sort of, not just a one-directional communication, but communication back and forth, so that the community has a real voice and real involvement in that. And then the final two pieces, just to go a little faster, one is then thinking about how those policies get implemented. A huge problem in public health law is that you work really hard, you get a law passed by the legislature, you declare victory, and you go home. And thinking about the implementation piece, the enforcement piece, the funding piece, to make those things sustainable over time is incredibly important. And then the last piece is the evaluation piece, to make sure that if you spent all this time and energy and money putting a policy in place, and had some good reason to think that it was going to be effective, you want to actually do the evaluation and make sure that it is doing what it was supposed to do. Because if it's not, then you want to go back and think about what can be fixed or redone. And if it is, then you have a good evidence base to share with other communities or to build upon, and go from there. So that's the I know that was a lot, but that's sort of the big picture framework. I can't hear you.
I'll be honest, for me, it's a huge picture framework in that there is so much there. Really simple, basic question. Is this one of the first books out on public health law?
So it's not, but I think this model and approach that we are using that I just described is the new. That's what we mean by the new in the title of the book. In that, a lot of the previous books that are out there are much more standard sort of legal treatises. So there's some that are sort of more traditional law school textbooks, so cases and notes about public health law, and then there's some that are more legal treatises that are more, some of them are explicitly sort of bench books for judges, sort of this is how public health law works. But the audience is really or the idea of those books is based on the sort of older idea that public health law is something for lawyers, and we're really trying to push hard back against that, because if you think about who's actually doing the work of public health law in practice, most of those people are not lawyers. So we have health departments in every county around the country, every state around the country. The vast majority of people who are in those departments are not lawyers. There are lawyers who are there, obviously, working with them and assisting them, but the people who are doing the policy development, the people who are doing the enforcement, The 99% of those people are not lawyers, but they're the ones who get the expertise on what it is actually like to do public health on the ground. And it's not just health departments. A lot of what other governmental departments do is public health or has a huge impact on public health. So that's another piece of this as well, is understanding that when you're thinking about the way that law impacts health, you're talking about a huge percentage of what government does. So transportation policy is public health policy, education policy can be public health policy, all of the housing policy is certainly public health policy. All these different things have a huge impact on health. And so the people doing those things, enforcing those things, are not lawyers. And the idea is to get people doing those things to be thinking about law as a tool and to be thinking about health as a priority as they're working on those issues.
So it's interesting. You what you're describing to me sounds like the Carl Saganization of law, and and what I mean by that is this idea of making. I mean, Carl Sagan's famous for making physics more accessible to individuals. I'm not sure exactly how accessible it is. I couldn't get through all the chapters. I know it's supposed to be easy, but like he was speaking like 9 levels above what I can understand. But I guess that's part of my question. What you're trying to do is take law and make it understandable, applicable, usable in the hands of people who actually have to use it. My question for you is, how easy is it to translate? Have you faced any kind of feedback on was it translatable? Did you kind of to me this describes the inevitable informed consent problem, which is, oh, we're going to take a really complex scientific document and have the average person read it and understand what's going on with it. And it just doesn't work. As much as we like to say that it does, the truth is giving someone a 60-page document is not true informed consent. So is this the same thing?
Yeah. So a couple responses to that. So one would be, as I said, the idea is here to be transdisciplinary, which means the idea is that you are helping other people in the process to have some understanding of the law and the basic concepts and ideas, but not that they're going to be lawyers, just that they're going to be able to have productive conversations with lawyers. And it works, as I said, it works the other way too. It also requires the lawyers to do their own homework to be able to have the conversation about the science and not just think about science as something that is instrumental. You look at the conclusion and decide if you like it or not and put it into your brief, but to actually understand the research that is going into whatever the subject is. So at that level, I think it's certainly something that can be understood, that the language can be kind of broken down and shared. And a lot of people working in public health, I actually get it's interesting as someone who teaches in a school of public health. I often get people who actually weren't even my students, who graduated from Ohio State, who will reach back out to me and say, now that I'm in practice, I realize that a lot of what I'm doing is law. I wish I had learned more about this and how this works when I was actually a student. So my second point is, I think I'm an optimist, and optimist based on experience, that the basics of law can be taught and understood without people having to go to law school, through courses that are paired with some experience of actually doing. But I think a major barrier, and something that I've been spending a decent amount of time working on over this past year, is rethinking the curriculum in schools of public health, because it's not something that is actually taught in most schools of public health, and it's a requirement in almost zero schools of public health. So, the Change Lab Solutions, which is based in California, has been working on this issue with the CDC's public health law program, and they did a survey of of public health, public health graduate programs around the country. And there are a few that offer courses in public health law, but it's a requirement almost nowhere, and it's a requirement almost nowhere because of the accreditation requirements for schools of public health. There are certain things that they have to teach, and there's not a lot of flexibility in the curriculum, and so it's changing that and getting this put in place is very difficult. But I think it's really, really important because what we know from the evidence is policy is essentially the most effective way to change and make progress in public health. But a lot of the training in schools of public health is really focused at the programmatic level. And there are of course like valuable, useful public health programs and services that are provided, but to teach that to the exclusion of the legal side and public policy side, when we know that that's the way that more significant advances are historically made, I think is a problem. So I've been working with people around the country to sort of think about how we can work more at institutional level to get schools of public health to start thinking about that more. And my experience at least has been that students really, really want to have that concept. And I think that's actually something that has been supercharged through the pandemic, that they realized that the decision making was not, it was not about providing programs to people. It was about what are we going to do at a policy level to deal with this pandemic, and how do we go about thinking about what the legal structures are, and who's got the authority to do what. What can health departments do? What can't they do? What can cities do? What can states do? Those types of questions. Students really want to have more background and knowledge about those questions.
So I'm thinking about my experience, and my experience, a lot like yours, is a lot of FDA type work. And one of the constant criticism about the FDA is that they're always behind the times, that they're always sort of responding to a crisis, if you will, for lack of a better term. What I hear you talking about, Mike, and please correct me if I'm wrong, but what I hear you talking about is this idea that let's be proactive about the decision-making process, because that will enable better decisions, more sustainable decisions. Very laudable goal. How likely is it, based on what you're seeing, that that's something that can happen? Or is it one of those situations? One of my favorite Mike Tyson quotes is, and that's not something many people say, but my favorite Mike Tyson quote is, everyone has a plan till you get punched in the face.
Punched in the face. Yeah.
Exactly.
So I think a lot of, so this is actually the book that we just released is the second edition of the book. So we spent a good amount of time thinking about what the lessons were from the pandemic. And I think what was most frustrating to us was, we thought that this framework, this transdisciplinary framework that we laid out, was not just a good idea in theory, but that we were actually descriptively talking about what happens in public health practice and public health policy making, and why it's important to have people who are, have that background and are trained for what they're actually going to experience when they're in practice. And I think what was frustrating in the pandemic is that, the transdisciplinary aspect of it largely got thrown out the window when the pandemic happened. And there are lots of different dimensions to that, but I think a big piece of it, at least initially, was handing everything over to epidemiologists to make decisions. And I work with epidemiologists. I have great respect for the work that they do and the science that they do, but epidemiology gives you information. It informs policy decisions. It doesn't give you answers as to what is the right thing to do in any given situation. And so sort of limiting that the decision making to people who are largely epidemiologists, or in some cases even kind of more basic sciences, which is even a more bigger problem. Without thinking, I mean, you saw it unroll through the course of the pandemic that sort of insufficient attention was paid to the human part of it. And fewer, not bringing in the experts and thinking about, all right, what is this actually going to mean for the likelihood that people are going to accept and act on these recommendations, and how this is communicated to people, and people's level of understanding and tolerance, and people's understanding that health is important, but there are also other things that are important to people in terms of the way that they act in their daily lives. And people who are not experts in science have a hard time understanding when science changes and the recommendations change. And so the epidemiology was important, but the failure to, and the legal piece too, like the failure to think about how are the courts actually going to look at this over time. So a lot of that was really incredibly frustrating to me and my co-authors on this. And so that's and I think it's sort of led to changes in public health law on the doctrinal level that we're going to be stuck with and are potentially going to be problematic for the next pandemic too. I guess that's sort of the negative piece that, I was frustrated by the way that this played out. So I think that's reinforced my interest and desire to kind of share what we see as the important piece of this model. On the other hand, like I have some optimism too that the FDA, is at least in some circumstances now thinking about the need for bringing in a wider range of experts to, I think coming out of the pandemic, coming out of the, not coming out of, we're still in the sort of opioid crisis, realizing that, just looking narrowly at the epidemiology or just looking narrowly at a product approval decision can lead to problems further down the line, and bringing in other types of social sciences and ethicists and others is something that's important to kind of build into the structure and do from the beginning rather than waiting until there's a crisis.
So we've sort of danced around this idea, and we're towards the end of the conversation, but I wanted to raise it because we've been talking theoretically for the most part, and I want to take it to a more specific scenario. And we've talked about the scenario, which is pandemic that happened, and I want to explore exactly where we are, what it means, all that good stuff. So a couple of things that pop up in my head. So number one, in the case of intellectual property, like in patent law, there's a core case called Diamond v. Chakrabarty. Like, it doesn't matter where you are, what you're learning, you start with that case. Like, everyone knows. And I forget, there are those seminal cases in like property law, as you remember, and contract law. And my first question is going to be, what is the seminal case in public health law? And what did it stand for? Did it come out of this pandemic? And my second question that comes up, I guess my third question that comes out of it, so you can answer all of them in one go, if you will, is how does all of this translate to how we handle the pandemic versus are handling the pandemic versus will handle the pandemic? And what I'm referring to is this idea that when we started, everyone was like, I want the vaccine. Now you're seeing Pfizer and Moderna practically begging someone, take my vaccine. And how will that translate in the future if we have a pandemic, about whether the vaccine will be required from a legal perspective?
Yeah, so the seminal case question is really interesting because before the pandemic, there was wide agreement about what the seminal case in public health law was, and it was Jacobson versus Massachusetts from 1905, which was a case about compulsory vaccination, where the city of Cambridge, the health department of Cambridge, Massachusetts, required vaccination to in the context of a smallpox outbreak. And Henning Jacobson, who was a reverend, objected to it sort of on mixed religious and health reasons, and appealed it all the way to the Supreme Court, which upheld the vaccination requirement with, it's a short decision. You can go read it, but with some sort of broader language about the importance of deferring to legislative judgments about how to deal with public health issues. So, the idea that, there's always going to be disagreement about the evidence, but somebody has to make the decision, and it's not the court's job to step in the middle of that and second guess that unless there is a clear constitutional violation. So that was one piece of the decision. Then the other was just sort of broader public health language and sort of the idea of a sort of community contract that, when you are agreeing to live in a community, you are, then bound by those decisions that the legislature makes. And if everyone could sort of make the decision for themselves about whether or not they were going to follow public health laws, then, we wouldn't have public health laws that were effective. And so that basic principle for 100 years was sort of the basic piece of public health law, that, you might not agree with, requirements for, school vaccinations or other things, but, those are valid legislative judgments, and that's what needs to be done for public health. And it's not the court's job to step into the middle of that and second guess that. And the big question is whether that basic framework has now survived the pandemic. And we had a bunch of decisions from the Supreme Court, and there was a clear sort of shift in power after Justice Amy Coney Barrett took her seat. And the court is sort of increasingly, at the Supreme Court level at least, increasingly skeptical and increasingly willing to second guess legislative judgments about what is appropriate in a public health context, and was increasingly skeptical or dismissive of the sort of broader social contract language, and really viewed things from more of an individual rights perspective without thinking about the broader public health impact. And so that was what I was referring to indirectly when I was saying we've had sort of legal doctrinal changes over the course of the pandemic. And I think it's, yet to be seen what the long-term impact of that is going to be, but I think it's potentially dangerous for purposes of public health. So that sort of was the foundational case for public health law, and now it's largely been shattered. And so I'm teaching public health law again starting in January. So I'm sort of trying to think about how you present this, as this used to be the foundational public health law case, but now it's not so clear. So that's one piece. I mean, the second piece of it is, when you're talking about public health law, you're talking about public policy and you're talking about government. And the way that this pandemic became politicized in a very partisan way, I think is goes beyond what happened in the past in problematic ways. So, I mean, pandemics and all sorts of public health challenges have always gotten entangled in politics. It's not like that piece of it is new, but the fact that it happened on such partisan lines and accelerated over time and accelerated in ways that then got encoded in law, where there was a quite distinct movement in a lot of states, largely red states, to take power away from public health authorities, has restructured the way that public health now operates at a actual legal level in ways that are going to be increasingly problematic. So I mean, there's we could spend another hour unpacking that, but and part of it is the I think a lot of it is sort of the information age that we're in the dynamic of, when you can't have agreement upon basic facts, it gets a lot harder to have a reasonable, intelligent conversation about policy and what is the appropriate thing to do. And when you sort of demonize the other side in politics and are going to fight back against everything that they do because of who they are, that also makes it difficult to have intelligent conversations about politics and policy. And a lot of that in the past, certainly not completely, but at least in part, got put to the side in the context of public health emergencies. And, we just didn't see that happen this time. And, quite the contrary, it just sort of became more politicized and more divisive over time. So I don't have good answers to that, but I think it just sort of reinforces the point that if you're going to be involved in public health and making public health policy, like learning epidemiology is important, but also learning about, communication, learning about ethics, learning about politics, learning about how people make decisions, learning about psychology, all of those pieces are important. You can't just sort of crunch the numbers and get any sense at all about how public health is going to work in the future.
That's amazing. Again, Micah, thank you so much for coming on. Just for people who are listening in, you can buy the new book. If you go to bit.ly/new public health law, you should be able to buy the book right off of Oxford University Press. Any parting words?
So I guess that was a lot. That's the big picture. My encouragement is always, for people to take their own expertise and try to think about the bigger picture. And in the work that you're doing, what are the opportunities to take whatever work you're doing and sort of think about what the implications are at a policy level, at a prevention level, and who are the people doing that sort of research? Who are the people who are doing thinking about the ethical questions, the communications questions, the implementation questions. And my job, what I love doing here at Ohio State is, helping to build bridges between people with different types of expertise to get together and think about these issues in ways that they haven't before. And so my hope is that I can kind of keep nudging people to do that in whatever their home space is.
Awesome. Micah, thank you so much for coming on.
My pleasure. Thank you.
These conversations are not intended to be legal, regulatory, or clinical advice and may not be right for you. These conversations are intended for educational purposes only. Conversations on this forum do not create an attorney